Continuing with its use standalone herb versus its combination, it is used in variety of along with other herbs. Very famously, we have say Pantakola churna with pipali pipali mula chavya chitraka and ginger there. So Charu Mahajanji asks chitraka alone versus its formula or in combination with many different herbs. Usually, it's made in combination with most of the other spices. As in case of Dantya, it's the Panchakola Churna, Panchakola Sava, even Chitrakadi Vati. So can it be used alone also, sir?
Yeah, Chitraka can also be used alone because there is a reference in the classical text itself that is saying that Chitraka Churna can be taken with Tilataila for a period of 1 month. And whereas even same Chitraka Churna, if it is taken along with Grita or combination of Grita and Madhu or with the Dugda continuously for 1 year, even the person may become it will enhance its longevity of the life of a person. Even Shatayushi, it has been said. So the person will be made to live longer by consuming this drug for these number of days. It's a single drug only, they are told. So it doesn't make any sense that we need to use only single drug or combined one. The combination is of the drugs has a special benefit and special area of where it is intended for. There are peculiar areas where we want to have the efficacy of Chitraka, but we don't want to have the side effect of Chitraka. In such a type of thing, better you use a combination of that, where at least Chitraka is there, but the quantity of Chitraka present in the combination is comparatively lesser, and which makes the action of the drugs. Always a particular single drug, if it is taken, these type of strong Ushnavirya and Tikshna Dravyas, it is better to take them in combination. If a single drug is taken, they have a special capacity, they can penetrate deep and they can cause if your calculation of dosage goes wrong. So it should be taken care of.
And any other side effects that we need to take care of, precautions like can it be used during pregnancy? We discussed that we need to take double care. What about lactation period during menstruation, and how long can it be used safely in other conditions where it is indicated, sir?
It can be safely used because see, the classical text reference itself is saying that one who takes for a period of 1 year. So such a long period time has been mentioned. So there is no one should have any doubt in the mind that how long it should be taken. It may cause some damage. No, it is not like that. It is totally depend on the way we consume the medicine and in the dosage for how long. So it is a comparatively safe drug to use even for the years together. So no, don't worry about the duration of the usage of these drugs. The point number two is where it should not be used. It should not be used in where a person is suffering from a severe gastritis, a person is suffering from a gastric ulcer, a duodenal ulcer, or bleeding through any of the openings from the body. It may be from any of the orifices if there is a bleeding, raktapitta type of conditions, petechial hemorrhages, or something bleeding disorders is there. So in those patients, care should be taken. This should not be used because it has all the tendency to improve the bleeding or further enhance the bleeding. So one should be very careful. It may be for bleeding from the gums, it may be bleeding from the nose, or it may be bleeding from the skin, or it may be from the menstrual bleeding, or it may be even the piles. Of course, you see, observe the typicalness. Acharyas are very clearly suggested to use this Chitraka in a dry variety or Shushka Arsha, but not in the bleeding or the Raktarsha. Raktarsha, we have a better drug called Kutaja. So that's the difference. We need to understand that.